Alright, so in the last video we talked about the anatomy and the histology of the respiratory system. So now we're going to start talking about some of the physiology. And so first we're going to cover in this video pulmonary ventilation. Okay, and so this is just, it consists of inspiration, breathing in, and expiration, breathing out. Okay, and so it's also going to be all of the related changes in pressure associated with that inhaling and exhaling. Okay, and so last time we talked about how that intrapleural pressure between the visceral and the parietal pleura here are critically important in order for you to be able to inhale and exhale, because this visceral pleura is sealed to that parietal pleura because there's a negative pressure in this space. Okay, so wherever the parietal pleura goes, that visceral pleura is going to follow. Okay. All right, and so atmospheric pressure is going to be 760 millimeters of mercury. That's referred to as 1 atmosphere. All right, and so that's important to consider because according to Boyle's law here, all right, the volume of a container, if you increase the volume of a container, that pressure in that container of the air, the gases in the container, is going to decrease. Okay, and so we're interested in that because gases move from high to low concentration, from high to low pressure, sorry, not concentration, high to low pressure. So if you expand the volume, the size of your lungs, the pressure will decrease, and if it decreases below atmospheric pressure, then air is going to move from the outside, the air around us, into the lungs. All right, that's how inspiration, inhaling, works. Okay, so again, inspiration works by enlarging the lungs, making them bigger. That means the pressure is going to go down and air is going to move from where it's higher in the atmosphere towards where it's lower in the lungs themselves. All right, and so in order for the lungs to enlarge, muscles will actually contract. All right, so inspiration causes active muscle contraction, and that contraction is going to pull the lungs open and expand them and make them bigger, so air will then move into the lungs. All right, so during normal quiet breathing, if you're just kind of sitting still, the diaphragm and the external intercostals are going to be the muscles that are going to be active for that process. So the diaphragm, as we talked about in that last picture we were looking at, right? So if we look here, so this diaphragm, it's kind of a dome-shaped muscle, and so it will come down and essentially like flatten, and that will pull the lungs down and lengthen them as it moves down and flattens. Okay, so the diaphragm lengthens the lungs, and then the external intercostals are going to kind of lift the rib cage up and kind of expand it a little bit, and that will kind of expand and lift the lungs as well and make them larger. All right, and so this normal kind of quiet breath when you're relaxed is called your tidal volume. All right, so that's the volume of air that you move during normal quiet breathing. And typically it's around 500 milliliters of air. Okay, and so you know that you can also take a really big inhale if you want to. All right, so you can take a deep inhale, deep inspiration if you want to, and so that would involve some accessory muscles, all right, to go beyond what that diaphragm and external intercostals are doing. So the accessory inspiratory muscles are going to be the scalenes. So these are muscles that attach from kind of your cervical spinal column down to your rib cage. So they're going to lift your rib cage up. All right, so that's the scalenes. The pectoralis major, you should know where that is. That's on your chest. And the sternocleidomastoid, you should know where that is, right? So that's connecting from the base of your skull, right, that mastoid process, to your clavicle and your sternum. So that's also going to help to lift up your rib cage. All right. So this volume, if you inhale, right, volume inhaled beyond your tidal volume, that's called the inspiratory reserve volume. Okay, and so that's usually between 2 and 3 liters. And so for your exam, I would say you'd need to know for these different volumes a definition for it, right? So this would be the definition of inspiratory reserve volume and what the typical volume is, right? The typical value is for that particular volume. Okay? And so we said with the lungs, they're full of this elastic tissue. And so there's a kind of measure, right? It's not, a number value, but a measure of how elastic the lungs are, and that is called compliance. All right, so how easily do the lungs stretch and then bounce back, recoil? All right, and so if compliance is low, that means that the lungs can't easily expand, right? So when you inhale, it's really difficult to expand and pull those lungs open. And this can happen a lot of times with fibrosis, so collagen forming kind of between those alveoli, making it so, collagen does not stretch, right? So they can't expand very easily. So scar tissue and that kind of thing could cause this. And then compliance, if it's very, very high, right, that would mean that the lungs have lost elasticity. And so they can't recoil or bounce back, right, when you exhale. And so a lot of times this is seen with emphysema, right, a high compliance is seen with emphysema, and it feels like you can't exhale all the air in your lungs. And so sometimes you'll get this, you'll see a patient with emphysema that'll have kind of like a barrel chest because they're kind of retaining air in their lungs because the lungs just can't recoil and get that air out, right? Because that elastic tissue is kind of degraded. Okay, so that's inspiration. So now let's talk about expiration. So exhaling. So with expiration, it's a passive process. When you're breathing like normal, quiet breaths, it's just the muscles relax, all right? And the lungs recoil. So there's no active contraction needed for expiration when you're doing normal, quiet breathing. Okay? So those muscles, the diaphragm, the external intercostals relax and the lungs recoil. And so because the lungs are recoiling, that volume is going to decrease, and then the pressure will increase as a result of that, and that will force air out of the lungs. Okay, so that's quiet, normal breathing. That's part of the tidal volume. So you can breathe, inhale 500 milliliters and exhale 500 milliliters for your tidal volume. However, you can inhale or you can exhale past that normal quiet exhale. That is called forced expiration. And that will involve your abdominal muscles and your internal intercostal muscles. Okay, so that volume is referred to as the expiratory reserve volume. So the volume of air that can be exhaled past your tidal volume. So typically that'll be around 1 liter. All right. And so let's look at this graph really quick and we can kind of like point out where some of those volumes are we just talked about. So with this graph, we're on the y-axis looking at volume in milliliters, all right? So this is going to be in the lungs, the volume in the lungs. And then off here to the left, this is kind of a depiction of an alveolus, okay? And so if we look, and it's color-coded, all right? And so what we see here is this person is doing some normal quiet breathing here, right? So quiet inhale, exhale, and then they take a big inhale in, all right, and then they exhale out as much as they can here, and then they go back to a normal quiet inhale and exhale and inhale. So that's what we're looking at, all right? So that would make this blue little arrow here, this would be our tidal volume, Okay, so that's our 500 milliliters that can just be inhaled and exhaled with a normal quiet breath. Okay, and so then the amount you can inhale beyond that normal quiet breath, right? So we do a normal quiet breath and then we do our big inhale. So that would be our inspiratory reserve volume. Okay, so inspiratory reserve volume. And then we can do a big exhale. That would be our expiratory reserve volume. Okay, and so then on the picture of the alveolus, we have our blue here. So this is kind of the range for our tidal volume, just our normal inhale and exhale. We can expand it beyond that. That would be our inspiratory reserve volume. And then we can go back to a normal quiet inhale and exhale. Then from our exhale, our lowest part on our normal quiet breathing, we can push more out than just that. That would be our expiratory reserve volume here in green. Okay, so then we have the purple. All right, and so the purple here is our residual volume. So that's the air left in the lungs after you have exhaled as much as you can. Right, the lungs are never completely without air in them, and that is called the residual volume. So that would be here in purple, and in here, right, that's the residual volume, kind of keeping those alveoli inflated. Okay, and so then if we add together all of the air that can be used, all right, for gas exchange, so all of the exchangeable air, that would be our vital capacity. Okay, so this orange here is vital capacity. And so that's if we add together our tidal volume, our inspiratory reserve volume, and our expiratory reserve volume. That is the vital capacity. Okay, and then one last thing to talk about with this picture is the dead air space. All right, so the dead air space is the air that is in the conducting zone. All right, and so it's air that cannot be used in gas exchange. So it's in those little, terminal bronchioles or the larger bronchi, the trachea, right? That's the dead air space. So it can't be used for gas exchange. Okay, and so that's what's represented here in this area. So this would be kind of like, if this is our alveolus here, right? This would be our terminal bronchiole up here. Okay, and so this line with the kind of crosshatches through this represents our dead air space. Okay. All right, and so typically the dead air space will be around 150 milliliters, okay? But with somebody who has some sort of obstructive disease, it could get higher, and we talked about like emphysema, where you can't exhale all of the air in your lungs. That would certainly increase that amount of dead air space. Okay, which means you're decreasing the amount of air you can actually exchange. All right, so that would be taking from your vital capacity. All right, so then obviously we can measure breathing rate as well. So that's measured in breaths per minute, typically around 12 to 15 when you're normal quiet breathing. So normal breathing is referred to as eupnea, right? So this would be normal breathing. All right, and these terms refer to the rate of breathing. So this would be breathing within that 12 to 15 breaths per minute range. So then if you have an elevated breathing rate, right? So this would be increased rate. That's called tachypnea. Just like tachycardia is an increased heart rate, tachypnea is an increased breathing rate. And bradypnea is a decreased breathing rate. All right? And then a patient can also be described as having dyspnea. All right? And so dyspnea is labored breathing. All right, so it's not necessarily breathing that is fast or slow, but it is breathing that is difficult, right? They're really struggling to get air. That's dyspnea, labored breathing. Okay. All right, and so then we can also measure the minute volume respiration. This is just the amount of air that's moved through the lungs in 1 minute. All right, and you would just simply calculate that by taking this breathing rate and multiplying it by the tidal volume, so the volume moved with each breath. So how many times are they breathing in a minute? How much air are they moving with each breath? That will give you your minute volume respiration. All right, and then another value that's kind of similar and actually tells you more about, how efficiently they're actually exchanging gases is the alveolar ventilation rate. So this alveolar ventilation rate takes into account that dead air space. All right, so it is only the air that can participate in gas exchange that is being exchanged in 1 minute. So it's essentially the same formula, except you take your tidal volume and you subtract that dead air space from it. So then that'll just give you the value of air that's actually participating in gas exchange. Okay, and so then also with patients, you can measure their forced expiratory volume. All right, so this forced expiratory volume, the FEV1, is the amount of air you can push out of your lungs in 1 second. And so typically, a healthy individual can move 80% of their vital capacity in 1 second. And so if you have asthma or you know somebody who has asthma, you've probably seen this test done. You can even get it's called a peak flow meter to do this in home to measure this FEV1. And so we'll see less than 80% in patients that have asthma or some sort of obstructive disease like COPD or something like that. All right. Okay, and so then emphysema, we've talked about a couple times. So just to discuss what causes it. So the alveoli with emphysema lose their elasticity, right? Like we said when we were talking about compliance. So they lose their elasticity, meaning the lungs don't bounce back, right? They don't recoil during expiration like healthy lungs would. And so individuals with emphysema can't expel air fully, all right? So they have an increase in dead air space, which means if you measured their alveolar ventilation rate, right, this dead air space would be taking up, right, instead of maybe being 150, it's 300, right? So now their tidal volume is down to 200, and so they're really not exchanging a lot of air during each minute. Okay, so that's with emphysema. And then there's also pleural effusions, all right? So this would be a case where between the pleura, right, in that kind of intrapleural space, you start accumulating fluid, all right? And so then this would also make it difficult for the lungs to, fully expand, right? So it's going to be, depending on how much fluid, it's going to start compressing on the lungs, and that will definitely reduce the amount of air that can be exchanged. All right, so that's it for this video. So in the next and last video, we'll talk about actual gas exchange. All right, so we're going to talk about internal and external respiration. So that's going to be gas exchange in the lungs and in the tissues. And then we'll talk about how oxygen and carbon dioxide are transported in the blood. And then that'll be it for that chapter.